When the pain subsides with epidural steroid or bed rest and medications, then we go for physiotherapy and lifestyle modification. What the greater advantage over traditional method by this endoscopy is less damage to the muscle, less damage to the ligaments, and recovery is faster. Hi friends, this is Dr. Vikram, Head of the Department, Senior Consultant Neuro Surgeon from Department of Minimally Invasive Brain and Spine Surgery, Sri Ramakrishna Hospital, Coimbatore. Let us know about our spine and the treatments available for spine. When the pain subsides with epidural steroid or bed rest and medications, then we go for physiotherapy and lifestyle modification, whereby we tone all the muscles which is supporting the back and change the lifestyle so that the patient doesn't get back this pain again, and strengthen the muscle so that other regions of the spines also don't get affected. But when none of this works, then the minimally invasive spine surgery comes into play. Traditionally, for more than 70-80 years, there is a methodology of spine surgery where there will be an opening in the mid of the back, depends on the number of levels which is getting affected. The size of the incision also will be more, and all the muscles behind the spine, what is holding the bone, will have to be retracted, cut from the main attachments of the bone, and we go inside, remove quite a bit of bone to remove the offending disc which has bulged and relieve the pressure from the spine. Yes, this is not a bad methodology. At the same time, this is a standard methodology, but there is quite a lot of muscle restriction, ligamental restriction, blood flow of the muscles get affected by this traditional method. Though with the traditional method you have good relief of pain, the destruction of muscles and ligaments plays a vital role in non-beneficial for further physiotherapy, because the muscles have become less blood flow, damage more fibrous tissue, so making them to get all the physiotherapy, muscle strengthening exercise become tough. That's the major drawback in traditional method. With the advance in technology, what we presently have are 4 different endoscopic methods. One, where from the around 8 to 10 centimeter in the back from the midline, we take a small needle directly into the disc space through what we call as a Kempkin triangle, a small space where there is no nerve or blood vessel here, where this needle is taken directly to the disc with the endoscope, and then the root is decompressed by removing all this disc and the pain is relieved. These are good when the disc is recently bulged, not hard, not calcified, and the canals are normal. And this gives only a small incision where we just need to put a single stitch and not much of disturbance to any of the muscles or the ligaments in the back. This is called foraminoscopy. The next technology is what we call a tubular retractor system, where we put a small tube about 1 centimeter size where the pathology is on the 2 centimeter just lateral to the midline, that is the center of the back, and then we put a needle, dilate the muscles. We don't cut any muscles, it is only dilated, and we create a space. Through that space we do small portion of the bone removal and the disc removal, protecting the roots. So again here there is not much of cut in the muscle, it is all only the skin, that is also about 1 centimeter or less than that. We dilate the muscles, go directly to the problem area and remove. The recent next technology is purely endoscopic, where we do what we call interlaminar endoscopy, where we go close to the midline with a small incision, we go between the ligaments, go directly to the disc space, remove all the disc which is degenerated and come out, decompress the nerve, and then we come out. So this is what we call interlaminar endoscopy. Here, when the canal is small with all bony changes, these systems are very good to handle all that. The next latest what we have is the unilateral biportal endoscopy, where we use two small incisions with only one bite requirement and go with two instruments directly to the bone, remove a small portion of the bone, remove the disc, decompress the root. Hardly you will have any scarring at the end of the procedure, and the muscles are preserved, the ligaments are preserved, so the patient can start doing back exercises once the patient wound heals and stabilize his muscles and the back later on comfortably. Yes, the change of lifestyle, exercise plays a major role, including the bed rest. Whether you do by endoscopy or you do by open method, your bed rest have to be at least 10 days in the initial phase, and then for at least for a month, where you can move around but don't put lot of weight or lot of strain to the back. That will allow the healing process to take place inside. What the greater advantage over traditional method by this endoscopy is less damage to the muscle, less damage to the ligaments, and recovery is faster. Even when there is a crack in the bone and one bone slips forward from the other bone, what we call spondylolisthesis, the bone will slip forward and cause pressure on the nerves and the canal. So in such cases, previously we used to have wide opening and put screws and bring the bone back to its original position, put lot of grafts and do the surgery. It is still holds good. As I said, this method again has lot of muscle dissection, muscle cutting, ligamental injuries, but with the advanced technology, with minimal access spine surgery, we take small incisions, maybe 2 or 3 or 4, depends on how many levels we do, go directly to the bone with a needle, put a screws into the needle, and with minimal invasive technique we can put rods, and we can even, as I said before, the multiple methods. One of the methods we can use for disc removal, and we can even put cages, bone grafts between these two bones and fuse these two bones in very small minimal access procedure. Again, the main advantage is less damage to the muscle even for instrumentation of the spine, less damages, less neural injury, and more faster recovery. Many of the patients can walk on the same day after all these surgeries, though we advise for healing process to take rest, but they can be better ambulant, less painful, less blood loss, less damage to the tissue. That's the main advantage of all these spine degenerative surgeries. When it comes to spinal cord tumors, whether it is lower back, the mid back, or in the cervical spine, same, the tubular retractor system, whether the tumor is within the spinal cord or outside the spinal cord, we can use the same technology without cutting much of muscles. We can dilate the muscles, take the system there, remove this part of the bone entirely with the endoscope, remove the tumor, and we can come out with safe. No fresh deficits will happen to the patients 95% of the time. With all this technology, with less damage, the patient can recover much faster. That is the major advantage of minimal access spine surgery, whether it is a tumor, whether it is a degenerative, whether it is a scoliotic correction surgeries, or whether it is a stabilization. All this with minimal access surgery, we can give better quality of life with less damage to the tissue. Thank you.